Up in the air, third man. Gully, someone. Oh, great catch. Wow, what a catch there. He might have hurt himself. But that is stunning. Shreyas.
Ball on the ball, or he's holding his stomach.
Hello everyone, I am Dr. Midun. Today I have come up with a very different topic. So I'm going to cricket today. We all might have watched the India versus Australia ODI series that happened in Australia recently. Australia won the first two matches and we were so disheartened after the initial two losses. We were hoping for a great win in the final match and Rohit Sharma and Virat Kohli were ready to fight back to win at least the final match of the series. We wanted to give everything to win the final match of the series, and the victim was Shreyas Iyer, the phenomenal batsman of Indian team, who took a diving catch and his spleen got injured and had a minor internal bleeding too. Today, I am revealing the medical facts behind the incident. So, it was the final match between India and Australia. The cricket ground in Sydney was electrifying. We all know that we know how Rohit Sharma and Virat Kohli used to fight back if they ever get a loss. So, Australia won the toss and they elected to bat first. They were moving to a very good total. We all know that Alex Carey is a dangerous batsman. We all know how dangerous he can be in the middle overs. He can bat long, he can accelerate his innings whenever he wants to. So he was batting nicely. Our Shreyas Iyer was fielding at the backward point. The ball was rising in the sky, and Shreyas Iyer was running backwards and he was diving forward to take a phenomenal catch. While taking the catch, the left side of his body hit the ground very hard. And after taking that spectacular catch, he got up and he was clutching his left upper side of the abdomen, and his face expressions showed that he was in very severe pain. Immediately, physio came in. They assessed him. His heart rate was shooting up. His BP was coming down, and he was in severe pain. He was feeling dizzy also. Immediately, he was rushed to the Sydney hospital. His vitals were stable, and he was rushed to the CT room to take a CT abdomen. The results of the CT abdomen were shocking. He had a grade 2 splenic laceration with mild hemoperitoneum, which means he has blood in the abdomen. Usually, in grade 1 or 2 splenic lacerations, if the HB is normal, if the vitals of the patient is normal, if the heart rate is normal, if the BP is normal, and if the patient doesn't have much pain or if the pain is reducing, we usually conserve the patient. That means we go for medical management. On the opposite, if the BP is coming down, he is going hemodynamically unstable, the heart rate is rising, BP is coming down, and he needs supports to raise the BP, and his pain is increasing, the internal bleeding is increasing in the abdomen, and whatever injury the spleen has suffered, if it is increasing and if it is associated with any other organ injuries, we have to go for splenectomy. Or if any of the arteries in the spleen are actively leaking, we have to go for splenic artery embolization also. So luckily in Shreyas Iyer's case, it was only grade 1 or 2 splenic laceration, and it was because of the blunt trauma that he suffered while taking the catch. So only conservative management was done for him, and luckily after 3 days he was completely stable. He was vitally stable. His HB was holding, and only closer observation was needed for Shreyas Iyer in this incident. So this was all about the incident that happened. We all know that Shreyas Iyer is a great batsman, and he has saved India in many of the matches, many of the ICC tournaments that happened recently. A cricketer gives everything for his country, but an injury that happens to his body, whether it be fracture or bleeding or a joint injury or whatever it is, that's the time cricket teaches him patience. And injury is the worst time for all the sportsmen out there. They have to undergo surgery, they have to do the rehabilitation process, and they have to come back. They have to tighten up their shoelaces and come back to the cricket ground, practice well, and play for the country again with full of strength. We all want Shreyas Iyer to play for India in the coming World Cup. We can all hope and we can all pray that he would come back, he would practice well, and he would wear the cap of India very soon. And he's a great fighter. Let's pray for the fast recovery of Shreyas Iyer And that's all about today's video. Thank you so much.